It's all yours.
Yeah, thank you, Tim, and appreciate the introduction. Still blush hearing otherwise because not used to it. But if you don't mind going to the next slide. So thank you for that introduction, and appreciate everyone's time today listening to us. As Tim said, I am a physician by trade and OBGYN and delivered babies for over a decade in private practice. And the good Lord had different ideas of what he wanted me to do in my life. And so he opened up doors for me to get into the health benefit administrative side of the business. But the frustration came from being an owner of an independent physician practice and dealing with all the expenses that we have to deal with, mainly, health benefits being the second line item behind payroll. And what could we do about it? And I was tired of two things. And that's the biggest frustration was, 20% rate increases from the current carrier year over year, with no control or insight into that. And then there was no transparency at all from the carrier on where the money was going. So, how well did the plan run? Why are my rates going up 20%? And so that, premise drove me to learn and understand the other side of the coin. So how are health benefits administered? How is an insurance company built? And so that's what we did. We started a Trinity Marketing Services, which is a program that offers self and level funded benefit solutions for employer groups, especially small to mid-sized companies, because that's who is currently being penalized in the current health care-based space. So it's time for a change. It is unsustainable, as you'll see, and that's why we got into it. So there's two sides and really value premises. One is transparency. This is your money. This is your hard-earned revenue for your employees. Is an employee benefit that needs to attract and retain good talent at your practice, which I know is a difficult thing to do. So it's a must to have excellent benefits to do that. And then really we got to bring service back to the industry. So, can you actually call and talk to somebody when you're trying to navigate this complex system of healthcare? So that's what we're here for to do. So it's to start managing that second line item behind payroll, showing you where the money goes, and really being compassionate about how your members engage the healthcare system and what can we do to help them do that. So that's kind of what we're about. Next slide, Tim. So we kind of all know the problem, and we've all been feeling it ever since the Affordable Care Act was passed back in 2010. Everything has gone up. Deductibles have skyrocketed. Premiums have gone up. But our wages and earnings haven't, right? So we don't really get to control how we're paid as independent practitioners. Unfortunately, we can only work harder and see more people, but that may not turn out to be the best model from a work-life balance, but that's all we got, right? So what else can we manage, in our practice to balance the books at the end of the day and make a profit so we can, help our families and help our employees at the end of the day. And so that's where Tim has done a wonderful job with his organizations to, not only bring value to independent practices and saving money on other aspects of the business. But now he wanted us to come in with Alera Group and really bring another piece to the puzzle, right? A solution that will help another line item that you have to deal with. And that's what we're here to do. So as you can see, that the problem is unsustainable at the end of the day. And inflation on medical inflation and expenses has gone absolutely crazy over the last 20 years, even more so in the last year, obviously, as inflation is a hot topic, but it's even worse in the medical field and what's happening with the cost of healthcare. So it is time to probably go buy a TV as opposed to anything else. But, we've got to do something about it. And my goal always has been, and that's what drove me into this in the first place, is I would love to keep the practice of medicine independent. And the only way to do that is to, come up with ways and to manage costs and improve, your business practice in general. So that's what we're here to do. So next slide, please. So what we're going to talk about, and I don't want to get super nerdy about it because it can get complex. This is not an easy topic, but I'll try to do my best to make it simple to understand. But the way that most independent practices are buying their insurance nowadays is fully insured. So on the right-hand side, you see, I go to Blue Cross of your state and I ask the broker or the rep for a quote, and they bring you, here's a premium of the gold, silver, platinum plan. And you pay that premium. 100% of it goes to Blue Cross, and then they cover all the claims on the backside and take total risk for that plan. Well, what you'll see in this country, and what most large employers have been taking advantage of for over 50 years, is being what's called self-funded. And the reason they do that is, one, once you take on a level of risk, you actually get to see everything. So you get to know where the money goes. You get to pick the parts and pieces of what's going on in your health plan. And so it's super vital to get away from the fully insured model if you can, and get into a self-funded arrangement, because it gives you so much more clarity and insight into where this money is going and how it works. And you can develop, ideas and strategies to mitigate the risk within your group. So if you have a bunch of diabetics, as an example, well, let's make sure we have some type of diabetic program that makes sense for your members, that will help prevent a bad outcome, which then controls the cost of the diabetics, in your particular plan. So just having that insight is huge. And, if you can't manage it, then you're not going to be able to control it. And going to a self-funded arrangement is definitely the first leap of faith. Now, what always sounds scary is like, what do you mean I'm going to take risk? I'm one heart attack or cancer away on a 10-man group that would blow up the plan. That's not the case anymore. And that's what our program has been built to do, is to look and feel like a fully insured plan, but you are taking risks. So you just take a small sliver of risk. So when you think about who pays for claims on the backside when this happens, your employee or member has a deductible. That's their risk. That's what they have to pay, but it's capped. So you pay your deductible, and then it's, then you're done, or you're max out of pocket, but deductible too. Then you have a layer for the plan. So the employer group will take a level of risk, but we cap it. And so there's a certain amount of risk you'll take, and then it'll be capped. And then you have what's called a reinsurer or a stop loss carrier take risk beyond that. So instead of Blue Cross taking 100% after the member's deductible and move, the employer group, you will take a small layer of risk, but we will actually make sure that we fund that risk to the total potential of it. So that way it's not really risk, because you're funding until the stop loss carrier kicks in. So you have a reinsurer that is there for catastrophic claims. They're just not picking up until a certain level has been spent. And so that's kind of the easiest way to kind of describe who takes risk on the backside. So it's not that you have $1 million, cancer, claim. You're only going to be responsible for just a small portion of it, and then the reinsurer will take the rest. So it's not as scary as it has been. It's built to be financially sound. And what we do on top of that, we call it level funding. And the reason it's called level funding is because we want it to feel like it's your premium that you're paying to your fully insured carrier. So there's 3 buckets that make up your premium on the backside. So you have your administrative costs. So the claims administrator, the network that you access, like Cigna, they charge, a per employee per month rate. Your pharmacy benefit manager has a cost. So there's several administrative costs that add up, and that's one component. The next component is your stop loss premium. So you are paying a premium to a carrier. They're just not picking up till later. So that's a component. And that usually the combined 2 of those around 50% of the total premium. And then what's left over is for claims. So that's your claims bucket, to make it simple. So we'll show you when you get a quote that you'll have this much in administrative fees. This is how much stop loss. Those are fixed. They go every month. So half your premium is going to go out to pay vendors and to the carrier that's backing the risk. And then whatever's left over, it goes in a bank account that is for the benefit of you. So it is your bank account. And we put the claims funding in there, and that's what we use to pay claims. And then, at the end of the day, that bucket has a maximum. So we'll pay claims as it goes. And at the end of the year, when everything's all said and done, if you run better than expected, then you get to keep that money. That is your money, and it is 100% yours. Some of these carrier programs that are level funded now, they'll do the similar type arrangement, but they'll say, you know what, but 50% of that I'm going to keep at the end of the year. Well, that's not fair and not right. So our value is that this is your money. We're here to take care of you and help you run your plan. And so we give, it's 100% of your money back. It's not, we give it back as your money in the first place. So we return that to you after the policy year's over. So the beauty of it is that if things run well and we try to manage your risk to the best of our ability, then you'll get money back at the end of the year. That whatever you can do with it, is up to you. So for example, I Trinity Marketing Services, our first year, we had 10 employees on our plan, and we got a check back for about 42,000 after it was all said and done. So for a 10-man group, I would have never gotten that back, but we had a good, healthy year and nobody had anything major, and it was nice to get that back. So what we did is improved our benefits for next year. So we, instead of having the bronze plan, now we're on the silver plan because I want to provide better benefits over time for my employees. And so that's what is the beauty of it, that you can use that money to help improve benefits or decrease the cost for your members for the following year. So it's just nice to have the option at the end of the day that you actually get to have insight, control, and we'll make it easy for you as a turnkey solution. All right, next slide. So what do we offer in general? There's three solutions that we offer. The first is the full health plan, the custom solution that is the full health benefit for your employees. The second is a pharmacy benefit management product where we just manage the pharmacy component. And then the last is our Intercept program, which is a bolt-on to a PBM product, which is a voluntary navigation and advocacy product where we try to steer members to the same drug at a lower cost because we know there's better ways to find that cost of the drug. So I'll go into these in more detail. But the first solution is mainly what we're talking about today because it's most people that are still fully insured and want to roll over is your turnkey solution. The other two are really for if you're a larger client already, you are already self-funded, then the pharmacy space is one of the most egregious, as I'll explain. And these solutions are better for your company and probably than your current PBM and any initiative that you're doing in pharmacy. So, but we'll concentrate mainly on the first one. So next slide. So it is a turnkey full solution. We come in and identify what solution would be best for you. And I mean by that, we've rebuilt an insurance product, right, from the ground up. And there's options. Every group's different. Every employer lives in different states. They may have employees in different states. They may have different needs. So we want to build, even though we may have custom plan designs, as you'll see, parts and pieces of it we'll recommend. But then there's others that there's flexibility based on where you are and what your needs are. So we may have a network that works really well in Florida if you're in Jacksonville, as opposed to using the Cigna network nationally, or maybe you do have employees all over and we need to use a Cigna network. So we are very flexible and want to cater to your particular individual needs. But, we also make it easy because we have the right solutions already picked on some of it. So it's full administration across the board. Accounting, regulatory and compliance support, and even COBRA administration when employees leave. So we do work with several national networks, depending on how big the group is. Cigna is our main national network that we do rent, from that perspective. But if you're over 100 employees, as an example, we can use that also. We also have other direct contracts and local community-based models, depending on what area of the country you're in. Like I said before, our Direct RX pharmacy benefit and our Intercept programs are already built in to the full health plan solution. So that's kind of the nuts and bolts and workings on the backside. And then on the member experience side, one of the biggest problems, like I said, is customer service and communication. So we have a concierge customer service team. You talk to a human being in the United States. So when you call our number, you reach somebody that can help you. And if they can't help you off the bat, they'll direct you to the person that can within the organization that will, depending on your particular issue. So for example, if you're at the pharmacy and the pharmacist at Walgreens doesn't enter your information correctly, which happens, a lot with pharmacies, you're one call away from us to, troubleshoot while you're at the counter with the pharmacist and enter the right information in. So we bend over backwards to really try to help our members out as they access care across the spectrum here. Like I mentioned, the member navigation, that's really all about, maybe you don't know where to go to the doctor, and we can recommend, some centers of excellences around where you are for, cancer treatment, or you need a knee replacement. You don't know where to go. You call us and we'll find out the best 3 options and give you those names and numbers. Or we may say, hey, you're on Humira. That's really expensive. I can get it through mail order, for half price for your group. Let's, waive your copay and do that. And so we like to navigate members to better cost, but higher quality providers. And then, of course, with analytics, if you want to know where the numbers are and get how detailed, we'll show you. So we'll have general summaries and reporting, on a monthly and quarterly basis on the group. Every month you'll see where the money's and goes, every dime, and then quarterly you'll get clinical reports of like, here's your top 10 drugs, here's that expense, here's your top 10 facilities, here's the top 10 medical diagnoses within the group that are, that we need to think about that are driving the cost. So just having a lot more insight into that. And of course, we do it HIPAA related. We're not going to tell you, Betty's the person with this diagnosis. So we're very conscious of that. So you will open up to a whole new world of insight, but we're careful about how we do that with each employer group. So, and then of course, we always want to promote wellness and any kind of chronic care management, like diabetic programs, like I said. And then finally, it's easy to kind of get a quote. And as we'll talk to at the very end on how to do that. The traditional way to do this is you had to have every single employee fill out a medical questionnaire, but that was extremely painful. Nobody wants to give their history just to give a quote. So now through technology and AI and all the things that are going on in the tech space, there's pretty much Big Brother now, and you can run a census through it and it'll tell you, what we think the rate should be based off of the risk of that particular group. So it is very individualized. There is underwriting involved, but it's very easy from your standpoint to get a quote. And just so you understand, the program's not for everybody at the end of the day. So this is a solution that we want to present to as many clients as possible. But at the end of the day, if you're a 10-man group and have 4 diabetics that are on, expensive diabetic drugs, you're probably better off staying fully insured. And that's what we'll tell you. So it's free to quote, and we'll give you the best advice on, hey, I want what's best for your practice. And if we can help you out and get a better rate and you're better off being here, then we will do that 100%. But we'll also be very honest and not just say this is the only product out there. And, you're probably better off with the risk in your group to stay where you are. And that makes the most sense, for this year. Try again next year when it come up for renewal, and just take it year by year, as you should. So next slide, please. So as we'll give out to y'all, we try to make it easy. So there are 6 plan designs. When you think about it, we try to mimic very similar to the carrier-based model from that perspective in the small group market. We even named them, there's some metallics because everybody's kind of used to it, just to understand. It's not going to be apples to apples on every single thing, but we try to at least have a good blend of plan design. So you have the Platinum Cadillac plan that, no out-of-pocket deductible, great plan. And then you have all the way to a $5,000 deductible. So you have a difference in plan designs. You can offer more than one plan design to your employees. So that's a nice benefit. And then we also highly recommend HSA options. So there's 2 high deductible health plans that can be paired with an HSA. So we kind of have a broad spectrum across the board on that to make it easy. So very straightforward. Looking at deductibles and max out of pockets, and then looking at the copay structures throughout. All right, next slide. So I wanted to take real quick my last 2 slides just to talk about pharmacy, because it's, like I said, it's one of the most egregious components of healthcare. I mean, it's so bad that the pharmacy benefit managers have bought the insurance companies. So one little slice of an insurance company has bought the entire insurance companies now, which just shows you where the money's at in this thing and where they're making so much money off of all of us. So the way we want, and what you're seeing, because it's on the news every day now with Congress looking at these bad players that which are Optum, CVS Caremark, and Express Scripts. They're under a high scrutiny, and for good reason. So the way that we redevelop the way a pharmacy benefit should be managed is that it should be cost plus. So what happens on the traditional model is that they're going to charge you one price for that drug, but they're only paying CVS this much for that drug, and they're keeping the difference. So they're going to say, hey, I got a heck of a deal for Humira. Humira is $6,000, and then they're only paying, CVS $4,000 on the backside, and they're keeping that $2,000 in between. And so what we do is we know what CVS buys the drug for, and we give them a $10 dispensing fee and a small admin fee to process it, and that you get the cost plus. So it's not nearly as egregious with spread pricing like the traditional model. So that's a very important thing. The other thing that's a trick of the trade is that these manufacturers provide rebates back. So just having that drug on the formulary for your members to access, the manufacturers give a rebate to be on there. Well, in the traditional model, not a lot of that comes back to you, or at least 100% of it. So we have our own contracts with the manufacturers, and it does 100% come back to you. So if there's a rebate on a drug on the formulary, then that money comes back to your claims fund to help, pay for costs. So having a cost plus transparent model plus 100% of rebates back is really a different way of thinking about how we should manage pharmacy at point of retail. And to that fact, we have contracts with all 69,000 pharmacies. So you can go to CVS, Walgreens, Walmart, Costco, wherever. So, I mean, it's in most every local independent. So it's not like we're restricting where you go. So you can go to the same exact pharmacy you go to now, but you're paying a better price on the backside. And there's over 10 million people on this platform on the backside. So very, very smart way to run your pharmacy benefit. All right, next slide. And one thing that we realized as we were doing it, and that we can get even better pricing than we can get at point of retail. So just because CVS buys it at wholesale at this price plus the dispensing fee, we can actually find that drug even cheaper. And there's several different ways to do that and find it. But we have a program called Intercept, where if we identify a member taking Humira, for example, and it costs $5,000 on the backside through the PBM, then we can actually source it through mail order for $3,500 as an example. And so we will ask the member, hey, instead of paying a copay to get it through CVS, would you like to get it through mail order? We'll waive your copay to incentivize that behavior. And then the plan only pays 35 to 50% less on the backside for the cost of that drug. So it's a win-win for everybody at the end of the day. So there's ways to acquire drugs at a cheaper price, and we just want to voluntarily, say, hey, member, would you like to do this program? And we usually get about a 96% acceptance rate, because it's a raise for them at the end of the day. If it's $100 copay or a $250 copay, I mean, that's over $1,000 a year raise that member doesn't have to pay anymore for that. So it's a win-win, and it's really helping out your employees across the board, because pharmacy costs are skyrocketing on the backside. It's about 30% of your total healthcare costs now, which it used to only be like 5%, a decade ago. So it's that's where the money's shifting, especially in the specialty drugs. Every drug you see on the commercials, that's what they're making a lot of money off of. And so we're trying our best to mitigate that risk. We want the same drug because they're great drugs. I'm a doctor. I want them to have the best of the best. But let's just try to find the best price for it. And that's what we do. So we see an average of 20% of savings across all total drug spend when we do this Intercept program. And it can work, if we're not doing the full health plan, it can work on top of any PBM that you're on now if you're self-funded. There's no cost as a standalone product. There's no risk. And it's an amazing program for the employer. And then for the employee, it's white glove treatment. We use our Southern hospitality with our advocates, and they do a great job talking to members, explaining the program, and helping them get their prescription through the mail order facility. So it's a benefit for everyone. It's been very highly effective. So just wanted to highlight the pharmacy aspect of it, because it's a growing issue within the space. But at the end of the day, this is a full solution. It is a health benefit plan. You will have, a national network. You see all the pharmacies. So, because I know at the end of the day, the most thing that matters is you want access and you want cost, right? So can I see my doctors, and then can I pay the same or better rate than what I'm paying now? And that's our goal, is to do that. And so appreciate y'all listening. And of course, we can answer detailed questions galore as we quote your particular group. So now I'm going to pass it over to Sam to explain the ancillary products that we include in this program too.
Absolutely. Thanks, Doctor. And just to sort of mirror what the doctor's saying, we do work with, statewide associations. We're dealing with veterinarians and dentists and other doctors, and we're seeing this work. We're seeing this work in small groups. So we'll touch on this at the end, where the most important conversation I think could happen, and that is just learning more about this and seeing how it would actually apply. I see the time here, so I'm going to try and keep things a little short. Obviously, the doctor's program here is definitely the second line item in your expenses. I'm here to talk about quickly the ancillary benefits that you can offer to your employees. So Tim, if you can go to the next slide. Really what we've done is we've pulled together this sort of an association product that you can offer your employees. You can pay through it through your company, or you can make it available to your employees on a voluntary basis. If once we reach the point where we have a conversation, we'll give you all the detailed information for the purpose of this webinar. Just know that you can offer either group paid or voluntary life insurance to your folks. We have a set limit at $50,000 for the group paid. It is really super inexpensive to offer this stuff. There's no medical questions. It's truly just an application. And then anyone that's eligible on your staff would have that life insurance. And then we have the voluntary guarantee issue, $100,000 for anyone that wants to sign up, $50,000 for a spouse, $25,000 for the dependents. And in my experience, I've offered voluntary life in almost every group that I have, because folks, to get it on your own, you have to go get the blood work, you have to make the appointment, the nurse has to come to your house, you don't know who to call, you don't know where to get it. It is entirely a convenience for your employee just to have the option to sign up through the workplace, have it taken out through payroll deduction. You'd be surprised how many people that work for your company don't have life insurance because they never took the time to go get it. So offering it to them where they just have access through an application is a real convenience for them. So Tim, if you could, the next slide. Same thing goes with short-term disability. Short-term disability is a policy that continues to pay an income to the person when they can no longer work due to an off-the-job accident or an illness, a pregnancy, a surgery. So this short-term disability is designed to provide 60% of a continuation of income while they're not working. That also can be paid for by the group, or you can offer it on a voluntary basis. And the next slide, Tim. If you go beyond the terms of the short term, that's where long-term disability would kick in as well. And unfortunately, in my career, I've helped complete too many of these where they're just not going to go back to work. Something has happened. They're impaired beyond the scope of the duties that they're required to do for work or even in their profession. So we do have the long-term disability. And while we're on this, I will add for the doctors out there, we do have a special IDI. It's an individual disability policy, which that we can talk offline and certainly help you out with those policies as well. And Tim, if you would, the next slide. Dental and vision, I'll talk about both of them in one slide, but we all know what it is. What we've done with the dental insurance, because networks are a thing, we just wanted to make sure that your in-network and out-of-network were the same so that we didn't have to worry so much about where to find the doctors and the dentists to go get the care that you need. So our dental insurance is set up so the in and out of network are the same. Once again, you have the option as the employer to pay for it for your employees who are eligible, or you can make this available on a voluntary basis, and we can discuss those when you have an inquiry. And Tim, the next slide is the vision. It's VSP network. Oh, and you're fine there. You can actually go to the last slide. Well, that's not the last slide. With our clients too, we know HR is a real big thing. Compliance is changing all the time. As Dr. Asher said, everything's changing. And thanks for the slide. I think I'm going to go look at TVs later, actually. We do have a core program. It's called Alera HR. It is an HR software that we like to offer to our clients, where you can actually find job builders, update handbooks, get alerts. The alerts are actually really nice. They drill down right to your local level. So you would get the local and then your state and then federal updates to changes in HR as they happen. And unfortunately, they're happening more and more often. So compliance is a real big, well, Well, something that we need to prepare for, because we're not going to see any less of it. So this tool is help you designed to stay on top of the changes. And then finally, Tim, the last slide, this is where we can get a quote. And if I can just, follow up with what Dr. Ashurst is doing and building this plan, this truly is, I've been doing this a long time, and I have never seen such a strategy changing in the healthcare spectrum than now. This is the way to go. What we have done with a lot of the clients that are currently now in the level self-funded is just have a conversation, get a quote, see how it works. We have certified producers as the Alera group. We're going to be your brokers that help you. And our producers are certified. They understand level self-funding. They can explain it to you so that you understand how it works and how it compares to what you currently have. And then you can make an educated decision on what you want to do. We have seen people that look at this and they're just not quite sure they want to do it. So they wait another year, they get a 40% increase, they're done with it, and then they take a look. So what typically happens, we are seeing a lot of savings for the groups that is being passed off to the employees. Participation's going up. I can't compliment the PBM stuff that the doc's doing. Honestly, we're seeing people paying way too much money for prescription drugs when there are solutions out there. We're seeing people who were paying $250 a month that are now paying next to nothing, just because no one took the time to give them the opportunity to have different options. So the real conversation, if you can get a quote, you can use the QR code to scan it, or you can go to the website. It's also on the Trinity Marketing Services site. Through PSMA, I would just strongly encourage you to just get information, find out how it works, see how it would apply to your own company. And then from there, you can make the educated decision on what's going to be best for you and your team. So that's everything I have, Tim. Doctor, thanks for pulling together that program.
Excellent. Thank you, gentlemen, so much. We do have a couple questions. I apologize. We're running a little bit over. So there's just two questions here. One is, how long does it take to transition to a self-funded program?
It's usually 30 to 60 days. We prefer 60 at least, because if you know when your renewal is coming up, so a lot of employers renew on 1/1. So start planning at least 3 to 4 months in advance, but we can, because the quoting process is so fast and the implementation and onboarding can be done easily within 30 days. And my manager would kill me, but we can do it within 2 weeks onboard you. But the more time, the merrier. So at least 30 to 60 days out. Let's 60 to start the conversation with Sam and his team about all the options and getting the quote in. And then that way you can have enough time for open enrollment and then implementation.
Okay, great.
And if I can follow that up, Doctor, once you get your renewal, that's the time to start the conversation.
Okay, excellent. And the last clarification that I actually had was with the pharmacy piece. Was it Intercept? You did say that even if you stayed with your current insurance provider, that you could participate in that portion?
That is correct. If you are currently have a self-funded plan, the Intercept will work for you. So a lot of employers that are over 100 employees enrolled are starting to already be in self-funded plans already. If they are, then this is a risk-free program that can be bolted onto your current PBM. But if you're fully insured, it does not work because only the carrier will get the benefit. You wouldn't get the benefit.
Right. Well, thank you so much, gentlemen. We really appreciate it. Thank you, everyone that has attended. The slide deck will be available as well as the full recording. So please contact us if you're looking for more information. And everybody that has attended will also get an email from us on the offer to use the health platform, our wellness platform as well for no charge. So thank you again so much. We're really excited about this offering and the transparency and the benefits that it can bring to our membership. So thank you very much. Appreciate it. All right. Bye-bye, everybody.
Thanks, everybody.
All right.